Hello, Dolly family. Let's see. This is the 20. No, it's not the 20th. It's the 6th. So it's my first post-op appointment. So I'm gonna go get ready, go get dressed and everything. As I'm laying here and I'm just like so relaxed. You just don't know. Not in bed, in my chair. But I'm chilling like a villain. So let's go get dressed and let's see how this goes. I have questions. Yeah, like this rash that I'm getting. Itchy, 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 itchy. Oh my God, I just want to scratch. I just want to scratch, 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 scratch. So, yeah. So, I got questions about medication. So I'm taking, have them take a look at, my bandage and everything to make sure we're doing everything correctly. Because we have to change out these on our own, the pads. And we have to change out the bandage on our own. I washed my hair the other day. Yay, I got clean hair. My hair smells great. It feels good. Oh, refreshing. Super stoked about that. So, let me go get dressed. Because I am so relaxed. I'll let you know how it goes, okay? See you in a little bit. Hi. Okay. Boom. I'm dressed just like that. Okay. So now I'm headed to the doctor's office. Guys, we got snow. Let me show ya. Isn't that pretty? So it's been snowing for like the past couple of days, huh? So it's snowing for like, I think it started yesterday. Did it start yesterday with me? Yeah. So, like I said, I have a doctor's appointment today. So this is my first pre-op appointment. Post-op appointment. So we got questions. Basic questions I got. Well, that rash, I've been itching. Oh my God, just going crazy with the itchy. And one of the medications that I'm on, I don't really have clear instructions on it. And other than that, I would say recovery's been going okay. Wouldn't you say so? Yeah. We changed the pads on here. It's been a learning curve, but I think we got it. I think the first time he did it, he wasn't quite satisfied with the way it came out. But the second time he did it, I mean, he seemed like he was quite satisfied with it. Yeah.
It could be better.
Could be better. Looks good to me, And changing the pads on here, we have to do all this ourselves. And I think he's become a pro at it. So it's comfy. I mean, as comfy as a brace can be. I don't take it off. I sleep in it. I shower in it. Only time I take it off is to change the pads or the dressing. And I usually after my shower, we'll change it out. I went for a walk yesterday in the driveway. It wasn't so bad. I think I did a good 5-minute walk, yeah, or more, yeah. And it was fine. It was kind of scary going down my stairs because my fear is, of course, falling. So I don't want to fall. But other than that, I think everything's been going pretty okay. I have not gotten into bed yet. to lay down flat. I don't sleep flat on my back anyway, so. But I have this really cool chair. Eventually, I'll give you a full tour of the chair. I got it at Bailey's for this sole purpose, for me and my pups. So, oh, that is one thing. Talking, I don't do a lot of it, or because it does get exhausting. Because yeah, up in here it starts getting. It feels like I'm having to. It feels like a job here. I'm gonna have to work really hard at this. So that's all I'm going to talk about for now. I think I made it 3 minutes before getting tired. So I'll let you guys know how the appointment went and any new information that I learned, okay? Love you guys. Be right back. Okay. Hi, everyone. So this is a whole nother day, because actually I started this video yesterday. And, yeah, I was, Lord, man. So if you remember, I was headed to the doctor's office, right? Because it was just my pre-op appointment. But while I was there, I was going to ask him about my some itching that I've been having, and I think I had seen a rash, possible rash. So I was just going to get all this verified, Well, so I don't know if I asked you in any other parts of the other video. So go ahead and take this time now before we get started, to go ahead and subscribe to my channel. I would appreciate it. Thank you. Also, go ahead and hit that like button. Let me know you like the video. Just don't forget to do that. You can wait till the end of the video, but don't forget to hit that like button. Also, don't forget to leave me a comment. I am getting around to all the comments. Seems like I'm being a little slow lately. Again, with all the medication I'm on, I do sometimes fall asleep. I fall asleep in the middle of trying to edit a video a lot. So, forgive me. Be patient with me. And don't forget to share the video, because sharing is caring. Okay. So, this video, I'm just continuing on from yesterday, letting you know how everything is going with the surgery. Sorry. So yesterday, I posted a little short about itching. So, my God, guys, yesterday was the worst day ever. The worst day, okay? I don't know, maybe there had been days that were worse, but for me, since I've been home, that was the worst day so far. Okay, so let me tell you what happened. So start out, I have been itching like freaking crazy, okay? So I'm itching, and so what I did, I didn't think anything about it. I just was like, well, I'll just wait. I go see him in a couple of days. I'll just wait until I go see the doctor and ask him about, what's going on. So I did ask him about it, and he looked at it, took the bandage off and everything, looked at the incision, see how it was healing up and everything. And I think it was a little red, so he didn't too much care for how it was healing. So what he did was, he's like, okay, well, it looks like my incision is a little red. So he ordered some antibiotics for me to start taking. And also, like around it, I was having an allergic reaction to the dressing. And I'm not surprised about that because I don't know, what am I not allergic to? So, so yeah, this really just did not surprise me. So yeah, I had these. So I had these red rash marks everywhere. So okay, so then he took that when he took that bandage off, he put some, I don't know, some sort of a cleanser or whatever to clean off the um the the sticky stuff, that was on there from the dressing, because technically we don't do anything with it. We don't touch the incision area, okay? That's very clear. We do not touch that incision area. We do not, only we can wipe it with a dressing, a clean gauze, like a dressing, a clean gauze. Um, but that's it. You don't put anything on it. You don't wash it with water or nothing. That's it. You don't get it wet, okay? If water seeps into the dressing, we are to change that dressing. Um, so this is what we know, and this is what we had been mindful of. So we make sure that never happened. Whenever I take a shower, we change out the dressing because everything gets wet, right? Right. So he's changed that. So he said, okay, well, I have another dressing to put on. So he changed it over to this other dressing. So it was like some silver thing. It was like silver wound dressing. I don't know if you guys heard of that or not, but it's very pricey. Changed it over to that. And I swear, I don't know. I put it on, and by the time they put it on, it was like my visit was over. So I'm like, they put it on, and then we're leaving, right? And immediately, it just feels like it's burning, right? But I'm like, okay, well, maybe it'll stop. So we get in the car and I'm headed back home. The burning didn't stop, okay? Matter of fact, the burning seemed like it just was getting worse. So when we got home, my son was like, well, do you want to go back to the doctor? Honestly, I did not. I just wanted to go home. I don't know what made me think going home was going to make things better, but I just wanted to go home. So I got home, nothing changed, it's still burning. Matter of fact, it looked like we took the dressing off. No, we didn't. We took the dressing, we did not take it off because we weren't supposed to take it off. This dressing was going to stay on until Monday, until I went back to see him. But we did notice that it was getting red underneath. It was showing that it was even more red. So we called him back. Eventually, he called us back, and he said to remove that dressing because it is a allergy to the dressing. So took that off. And at first, the assistant, told him to put on the old dressing, the one that we were using before that was making me itch. So we put that one on. And within no time, it was burning too. So I'm burning. I'm dying, okay? Doctor calls back. This time it's the actual doctor. And he says, okay, you can come in if you want to come in, but he says it's an allergy to the dressing. He says, just take it off. And he ordered me some cream to put around the dressing, but to be around the square area where it's red, and to not touch the the incision area, and don't get the cream on the incision, because that would be bad, and the surgeon would not be very happy about that. So I'm like, yeah, okay. Antibiotics are ready about this time now, but now we gotta wait on the cream to be called in. And they have not finished with that yet. They said it'll be another couple of hours before they can get the cream. So I'm just waiting. Okay. So he says to just go ahead and take off the dressing completely and not wear anything. But you see, and so that was okay. It was fine. So we went ahead and did that like immediately. And one, like I said, it was burning so bad. Guys, I just felt miserable yesterday. I was in so much agony, okay? And this is all because of an allergic reaction. So, there's two things I sometimes have a problem with. So, you know what? These daggone legs are so long. I just don't get them. I just don't get them. Anyway, I think I want these to go like that. Yeah, that works for me. So, but anyway, let me get back to what I was saying. So, basically it boiled down to is take off the dressing and just leave it off, and come see him again on Monday. And he'll take a look at it and see how it's looking. Because at this point, I mean, we're just going through everything, and it's just getting worse. So, because I didn't want to leave it exposed, honestly, it looks like an ugly smile. It does look hideous. And it looks like it's smiling at you, but this type of smile, yeah. So I put it in there, put the gauze thing over it. So it just has like a piece of tape slightly on each end. It's a different kind of tape too. So I did not put on that type of tape that that's causing me the issues. So what we did was, instead, we put on, we just put a few pieces of tape on it, and I'm knocking over everything. This is annoying when this happens. Oh, you know what I'm talking about? When all of a sudden you seem to just be the clumsiest person in the world, and you're knocking everything over. I hate that. Okay. You know, Miss Emily Rose has some big feet. Is it Emily or is it Lily Rose? I think it might be Lily Rose. Could be Emily Rose. I don't know. Anyway, she's got some big feet. Big old hands, too. So, but anyway, yeah, that's what happened yesterday. So I was feeling so bad that I just did not feel like getting on here and finishing up that video from yesterday regarding the doctor's appointment. Yeah, I thought it was going to be something simple, just give you an up to date, let you know everything is going well, let you know what the doctor says. He says I'm doing everything right. Not what actually happened. It seemed like, to me, it just seemed like I just kept getting tortured over and over and over again. They take they take it off. They're taking off of my skin, and then on irritated skin, they're putting another gauze back on. I don't know. And then it said take that off. Then he says to put another one on again. And now the skin is burning. And we're going to rip that off and then put more gauze on. More a different dressing. We already know I'm irritated. I'm irritated with, it irritates my skin. That was a terrible day. It felt so bad. It was burning, guys. My skin was burning. It was like on fire, okay? It was terrible. So, yeah. I think I just laid down and went to sleep. I did a box opening last night. And after I did that box opening, I didn't do the video. I didn't upload the video until this morning because, yeah, this just wasn't just terrible. But feeling so much better today. I have the cream to put on it. My son did that for me this morning. I'm taking my antibiotics. Oh, that's another thing too. So my son goes and get the antibiotics, right? So then the pharmacist tells him that it's a possibility that the that the antibiotics could mess my stomach up. I'm like, what? You kidding me? Why? Why are we torturing me? Why? Is this torture honey day? It's horrible. So, oh my gosh. I told them yesterday was the worst day. Bury that day under a rock and don't ever dig it up. No. But, yeah. So other than that, things had been going just fine. He did say that, other than, I don't know, I'm doing everything right I'm supposed to be doing, so continue that. So, and I had some people that had some questions about it, and then I had some people that, I had a lot of people who had questions, so I wanted to also answer those questions and, or address those questions. And I think somebody had mentioned that they may know someone, or they have relatives, or they may also be getting ready to, doctor has told them that they have to have this procedure done. First off, don't be scared. There's no reason to be. You'll be in and out. You won't even skip a beat. He scheduled it so fast, guys, because I thought, I guess, like I told you guys before, I didn't even get a second to, really have any fear, because, they scheduled it. I went in. I think they scheduled it like a couple of weeks out. I went in the same month, which was this month. And he says, okay, let's have surgery. I'm like, okay. And he says, okay, let's have surgery this date. And I'm like, wait a minute, that's only a couple of weeks away. So I did not get to I had tickets for the Nutcracker. I did not get to go to the Nutcracker. As he said, I was still in the hospital. So, yeah, that was not going to happen. I did not even get the okay to go home until, I believe it was the 28th. My daughter, however, because me and her were going to go together, but she still gets to go. She really liked it. She said it was good. She took her boyfriend. So my tickets did get used. Yay. We had an earthquake earlier, guys. That was pretty cool. Decided to work on my baby here, this body. And what I'm doing basically is I don't have the body that I want for her, but I have a lot of other bodies, so I decided to just fix it the way I want it, right? So also we've been doing our own dressing, because you have to, they did show us how to do that when we were in the hospital. So for those of you who are going to have to get this procedure done, it will be wonderful if you have someone to help you, to be able to help you with the dressing when you get home, and to be able to help you change the pads on your brace, because it works so much better if you have help. Trust me. And let me see what else. Now, as far as the procedure goes, like I said, I found out I was having the surgery like within a couple of weeks. I went in. I mean, we looked at it again. He explained to me again. And to be honest with you, there was really no other options. It is what it is. If anyone else if you have to have this done, or someone you know has to have this done, then you're pretty much aware of this situation and what's going on. So it is what it is, right? But don't worry. It's don't go on YouTube like I did and look at the procedure. That's horrible. Oh my gosh. Yeah, don't do that. I did that, and he was like, "You did what?" Yeah. But he did answer all my questions, and he did let me know what he was going to do. So really kind of cool, and I show you another picture of the actual picture of my hardware. That's what I call it. So you can see that there is like there's like a little bracket thing over it where he fused the two together. Inside, he had to make a filling to go in there. So they use like pieces of your bone, but they also use cadaver bone too, because there's not enough of your bone. So they have to use the cadaver bone. Okay? Is what it is. So, surgery went well. I think mine was about 2.5 hours. When I went into surgery, they prepped me and everything. You have to do this, before surgery, you take a bath. Not a bath, but you got to clean the part that's going to be surgically, done. So I did that. They'll give you something for that. It's not that big of a deal. Then they gave me just this surgical wash or whatever. And then when I got there, we checked in and everything, went to where did we go? Was it surgery? Was it? Yeah, so I guess surgery. Yeah. And then they took us back, got into my gown and everything. They put all of your your, what's it called? They get your IV and stuff ready. Mine went in here. Get your vitals. Took blood. They hook me up to fluids. I don't know if they did that yet or not, but they got the tube ready, because that's what And then, of course, the anesthesiologist comes. Everyone comes out and meets you. Anesthesiologist came out, talked to me. The I didn't see the other surgeon. I didn't see him until after, when I was still in the hospital. He came by and saw me, but I didn't see him when I was prior to the surgery. My doctor came to see me, the surgeon that was going to be the actual surgeon, not the assistant surgeon. He came to see me, popped his head in. I met the nurses that were going to be in the surgery with him. I met them. They all introduced themselves to me. And who else? I mean, yeah, I mean, you pretty much, I don't know if that's the way they do it at your hospital, but that's how they did it at mine. Everyone came out to meet me and talk to me, introduce themselves to me, you know. Then, and then I went, and then after that, you go into the hospital room. You say goodbye to my son. Bye. He goes to wait, and then I'm off to surgery. So, got in there. I think I met a few more people. The anesthesiologist came over. He was in there. Met up with him again. He was the last person that I talked to. Maybe it was a nurse that I talked to, but yeah, briefly after, they gave me my oxygen. Yeah, it was. That was it. So I woke up, and I was in this room. You know, the post-op room, the after surgery, which is right next to the surgery room. They take you in there to, yeah, I guess to make sure everything's okay. Before they release you up to your room. Now that is when, for me, I got a little scared. I don't know. Maybe because I went in and I came out. I don't know. I kind of like freaked out at this moment. So, and you know what? I don't know who this nurse was, but she was so kind to me. Do you hear me? She was so very kind to me because I know that I was boo-hooing. And I must have grabbed her arm and asked her, do not leave me. Please don't leave me. You know what? She didn't. I remember that she told me she wouldn't. And she comforted me. She held my hand. And, she just comforted me. The whole time. I think I must have passed back out again because I woke up again and I was in my room. But yeah. Or they might have given me something. I don't know. But I do appreciate her. Like I said, they were really nice. They really were. So next thing you know, I was released to the 7th floor, which is the bone and spine floor. And again, I did not see my son. I didn't know who these people were. I don't know. At first go round, it was not that great. Actually, I started freaking out because I did not see my son and they would not give me anything for pain. I was in so much pain and they would not give me anything for the pain. I just remember feeling horrible and being so afraid because I'm thinking, oh my God, I don't know what they're going to do to me. My son is not here. I don't have no one to vouch for me. So, I did keep asking, and it got to the point to where I wouldn't even talk to the nurse no more. I didn't care to talk to them anymore. I only wanted to know where my son was. And I kept asking, where's my son? And they were like, well, they were supposed to call him down in post-op. Okay, yeah, maybe, but he's not here. And I know that he is waiting. So, you know, someone needs to call him. So at this point, and then they brought me a phone. And I didn't have my phone because my son had my phone. I do remember that. My son had my phone. So I did not have my phone. I don't have phone numbers remembered. So I could not remember his phone number. The only phone number I could remember was my mom's phone number. And she does not, that's her home number, which she does not even use because she's not there. So, couldn't remember her cell number for the life of me, because I know if I could have got a hold to her, she could have called him for me. She would have found him. I didn't know my daughter's phone number. I knew my phone number, but my phone, nobody was answering it. I think it was off, or maybe down low, volume cut down or something. I don't know, because it was kept going to voicemail. Finally, I looked up and there he was. Guys, do you hear me? I was almost in tears, okay? I was so afraid. I was so terrified. After he got there, things got better. I felt better. I got something for pain. Everything started going much smoother. By now, the next shift comes in, and it's much better now because they're communicating with me, and they're introducing themselves to me, letting me know who they are, and asking me how I'm doing and how my pain is and where it is, which they were not doing that before. That first when I first got on my floor, and the first crew that was there when I got to the floor were not doing none of that. It's like they didn't have a care in the world about me being there. And so that's why I've always said, and ouch. And that was one of the things that we wanted to make sure, is that I was not left in the hospital by myself. I was never at any point alone in the hospital. I mean, it is what it is, guys. So we did. The second crew came, and she introduced herself to me and everyone that was working with her, and her whole crew, and the people that would be coming into my room and stuff. And they got vitals and everything, which, as before, I don't even think they did. They did. I don't remember. Maybe they did. I just don't know. But it got better. So after that, it was smooth sailing. Everything was good. No issues, besides the fact that I could not swallow, which was, made it, and that was a thing too, because I do remember, oh yeah, the first ones, that first crew that came in, they did have me take pills. They had me to take some pills, and they had me to take it with water. Well, the problem is that I was choking. I could not. I couldn't drink the water. Okay. And it was like, I don't know. They're assholes. Okay. They just really didn't seem like they gave a crap. Okay. And I actually saw that one nurse again on one of my days there, because I was there a while. So yeah, eventually I'm going to see you again. I did see him again, and I told my son, I said, that's him. uh, yeah. So, but yeah, they gave me the pills to take with the water, which I couldn't drink the water. I was not able to swallow the water. The water was choking me, okay? So I'm like trying to take these pills. They're making me take these pills with the water, and I'm having the hardest freaking time. So when that next shift came in, and they came in like really quick after my son had got there. Um, I told her, and she was like, "Oh, okay. So let's try thickening it." Immediately, that's what she said, and I was like, "Oh yeah." And I've worked in healthcare before, and I probably could have thought of that, but at the time, that's not something that you want to have to think of on your own in the midst of not seeing family members that are supposed to be there, not knowing. You're basically in a state of mind where you're not knowing what is going on, okay? Because you just had surgery, you're on all these, anesthesia, drugs from the surgery. You're not in your right mind. Everything is not clear. You're confused. You don't know what the heck a doodle is going on, okay? And so, of course, I probably could have thought of that, but I did not think of that, okay? And it really was not for me to think of. Should have been something that the nurse should have thought of, right? Yeah. Well, anyway, she did immediately, and she immediately changed my diet. She also reached out to speech therapy and let them know, so they can come see me and figure out what was going on. And that's when that became the beginning of the problem, which was the reason why I did not get released was because I could not eat or drink anything. Yeah. So, but after that, everything was fine. They made sure that I was on a clear diet with thickened fluids. So my water was thickened, and when it was thickened to a nectar consistency, I was able to swallow. And as far as the pills go, they started giving me applesauce to take with them, which made it easier to get the pills down, versus trying. I've been doing that still to now. I just started taking my pills with water yesterday or today. I think yesterday or today, yeah. So I am just now starting to take pills with water. I am also able to eat most things. Well, I haven't tried to eat most things yet. I'm able to drink my coffee without thickener. I'm able to drink my water without thickener now too. But at first I could not. I came home and I was still on thickening liquids. But I'm good now. I can drink my water. I'm so happy too, because I've been downing water like crazy. Because that was a big concern too. It was like I'm not getting enough fluids, not water. So, but that was an issue. But I'm good now. I'm getting the fluids down. And I'm able to eat. So sometimes, from my understanding, is that sometimes most people get that back immediately. They don't. That was kind of uncommon for me to have that issue. So that was uncommon, and they want to know what was going on before they released me. So in order to do that, they needed to do a speech therapy test, and they were not able to do that over the weekend. Just so happened it fall under a holiday, and they were short staffed. So I wasn't able to get that until that Monday. But got it. Everything's all good. And I was able to go home. And what else? I can't think of anything else. Other than that, my stay was great. Everyone was really nice. Even the dietary staff, they were nice. He'd come up because they kept getting the food. He would come up. Okay, so I'm on a clear diet, right? So he'd come up and he'd come to get my my meal, my order. So he'd be like, "Well, what would you like?" I remember there was one time he says, "Okay, so we got this, 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 and this." So I said, "Okay, well, I want the soup." So I got the soup. He says, "Okay." He says, "We also had, he said, what about mashed potatoes?" I was like, "Ooh, that sounds great. I want mashed potatoes." So he says, "Okay." So then he says, "Well, what about ice cream?" I was like, "Ooh, that sounds good too." He says, "Okay, wait a minute. We got sherbet." I said, "Ooh, okay, I like sherbet." So he puts down sherbet. And he says, "What do you want?" Sorry, he says, "You want pudding?" I was like, "Yeah, I want pudding." So he puts down pudding. And then I got, I don't know, lemonade or something. So he's like, I was like, "Yeah, sure, I'll take some lemonade." So when my meal came, none of that was on there. I had 2 things of pudding and some tomato soup. That was it. And he came back and he did the same thing again. He says, "Yeah, I tried to put in." Guys. He goes, "Yeah, I tried to put in for the ice cream," where they were like, "No, she can't have ice cream because it melts down to a liquid." And and they said, "Yeah, the mashed potatoes." I said, "No, you can't have mashed potatoes." So it's too thick. I'm like, okay, well, you made me laugh if nothing else. So, yeah, that was funny. He came back and did the same thing again. And next day, he had all this stuff he was going to said I can have. And I got like 2 things of vanilla pudding. Oh, like, okay. All right. I did get mashed potatoes one time, and yeah, I choked on it. So no more mashed potatoes for me. But that was their mashed potatoes. Their mashed potatoes were weird. But yeah. I think I was trying to think of some questions that you guys had asked me or were concerned about. I know you have to get approved by you have to get, insurance has to approve the procedure before they can do it. So but if you're up to the point to where they are telling you that they won't, that they're wanting to do surgery, then I'm sure you've already been doing approvals this whole time, because I had to do approval for MRI, CT, bone density scan, bone test, MRI, CT. I think that's the only major one. Some X-rays, but you don't have to get approvals for those. You have to get approvals for like the big stuff, the MRIs and CTs, expensive stuff. And then you'll have to get approval for you know, you have to go through insurance and make sure. The only time your doctor, the doctor's office would do all that for you. They have a whole department who does the insurance approvals, you know, for the surgeries. You shouldn't have to do all that. I think that's it. It really was pain free. I didn't really have to do a whole lot um, on my, you know, as far as any of that goes. They did take care of everything. They got my paperwork for me. Oh, and I just got my paperwork done also after the surgery because, you got to think about, driving and all that good stuff, right? Yeah. So we went and got the parking thing. So don't forget about that because you're not going to be able to drive for a while. It's not 6 weeks. So 6 weeks before I can even, well, before I'm even going to get out of this thing and get to drive. So before I get the okay to, hopefully I get the okay to drive. But it'll be at least 6 weeks in all from surgery. So I think that I want to say the 30th. I don't know. I forgot. I'll count down again. Um, should be my 6 weeks. And then after that, I get put on a soft collar, a different collar. There's a whole stage. And then I think I start doing PT after that. I start doing physical therapy. Um, yeah. So it's a long process. I do I do say have some help. You do and you will need some help. Okay. You will need some support. You can't do this on your own. You don't want to do this on your own, okay? So, guys have any more questions, concerns, feel free to leave them in the comments. I have absolutely no problem with answering any of your questions, okay? I love you guys. Toodles. Peace.